IUI has been used for decades in infertility. It's a procedure that's a very low form of intervention for the woman, and for many women, therefore, it offers a less confronting approach with some mild stimulation and less confronting intervention. So what is IUI? Well, IUI is a process where we take the sperm, it's the lab staff, the clever lab staff that actually are activating the sperm to make them undergo a process called capacitation, which makes the sperm very vigorously motile and able to activate and fertilize the egg. Effectively what the cervix does when it's functioning well. So that's the process of IUI, or intrauterine insemination, sometimes called artificial insemination. This is often combined with trying to make the woman ovulate perhaps a couple of follicles. So not to be confused with ovulation induction, which is for a woman who doesn't ovulate on a regular basis. This is for a woman who ovulates regularly, obviously has fallopian tubes that are open, and a partner has a normal sperm count. So it's a treatment for unexplained infertility. So basically, because she's already ovulating, perhaps we might release a couple of eggs to try and maximize the chance. And I suppose that's the way you should really think about the IUI treatment. Everything seems to be working okay at the moment, but we're just trying to improve it a little bit to try to maximize the chance. So we'll prod her ovaries gently with some mild injections, just to perhaps release a couple of eggs. So for her, she won't really notice many more hormonal signs, for instance, compared to IVF, because she's only having a couple of eggs released. When it's coming to ovulation time, which we'll often give her a trigger injection for, we will ask a partner to produce a sperm sample, and as I said, the lab staff will stimulate that sperm, and the nurse or the doctor will perform the insemination procedure. And the insemination procedure, it sounds rather confronting, but it's actually less invasive than a pap smear. So they're basically looking at the cervix, and you have a very fine, flexible catheter, a little straw, which is passed in through the cervix, and gently some fluid is pushed into the uterus. Many women are a bit confronted by the idea. Perhaps they find pap smears uncomfortable, or perhaps they've had what's called a hysterosalpingogram, where we check the fallopian tubes are open, and that unfortunately can be quite uncomfortable because the radiologist has to push quite hard to push the fluid into the uterus and all the way out of the fallopian tubes. This is a much more gentle approach, and most women do not find it uncomfortable at all. In terms of how effective it is, well, I generally advise that it's probably about 2 to 3 times increased her background chance. Because remember, this woman has ovulating, her fallopian tubes are fine, and her partner's sperm's okay. This basically doubles to 3 times her background chance. So therefore, you can perhaps see, well, where is its place? Well, its place is obviously therefore in a woman whose chances is not that poor. So somebody with generally a couple who've got a relatively short duration of infertility, or a woman that's generally perhaps under 35 years of age. So there's obviously no point in doing it to somebody who's been trying for 10 years to get pregnant when everything seems fine, because to double the background chance of somebody who's been trying 10 years is obviously going from a very low level to perhaps slightly more than a very low level. Also, perhaps it's not a sound investment of a woman's time if she's in her mid-30s onwards, because perhaps at that point we are getting to more concern about the decline of fertility with age. So controlled ovarian stimulation with intrauterine insemination has its place in the younger couple with a short duration infertility. It also has its potential in instances where perhaps the sperm parameters are just a little bit reduced, so this process may well improve the sperm parameters. It may also be its place in women with a mild degree of endometriosis, because there's perhaps the environment in the pelvis is perhaps not conducive to implantation, so doubling or trebling the chances may well assist. And also it does have its place in some women who are, or even some couples who are confronted by the process of intercourse. So some men have difficulty with vaginal penetration. Some women find the process very confronting, and they struggle. So the process of intrauterine insemination does have its place where sometimes intercourse is challenging for couples. So controlled ovarian hyperstimulation and IUI treatment has been practiced for decades. It's a very very well recognized treatment. There are probably millions of children and adults born in the world from it. And this is an effective treatment in its right place.